If you are entering Medicare in 2026 and needing to choose Medigap coverage for original Medicare, you will probably hear two letters more than any others: G and N. Medigap Plan G generally costs more each month, but it leaves you with fewer out-of-pocket medical bills. Medigap Plan N may cost less each month, but you agree to pay several expenses yourself, and some can be substantial. So which is the smarter choice? In this video, we are going to compare Plan G and Plan N in plain English, without turning original Medicare into a college course. Welcome back to Wealth Horizons, where we discuss practical ways to protect our money, health, and independence throughout retirement. This video provides general educational information and is not insurance, financial, legal, or medical advice. Benefits discussed here reflect the standardized 2026 Medigap rules. Premiums, availability, and enrollment rights vary by company, state, and individual circumstances. Medigap is private supplemental insurance that works alongside Original Medicare. Original Medicare pays first, and then your Medigap policy helps pay certain deductibles, co-insurance, and co-payments that Medicare leaves for you. That is the gap in Medigap. You pay a monthly premium to make many of the expenses left by Original Medicare more predictable. And just to clear up the alphabet, there is no Medicare Part G or Part N. Those letters identify Medigap plans sold by private insurance companies. Now let's look at your broadest, generally available choice. For someone entering Medicare in 2026, Standard Plan G generally offers the broadest standardized Medigap protection available. On the hospital side, Original Medicare Part A can leave you with a hospital deductible and additional costs during a long stay. Plan G covers the standardized Part A hospital gaps included in the policy, including the hospital deductible and covered hospital co-insurance. On the doctor and outpatient side, Medicare Part B generally pays 80% of the Medicare-approved amount after you meet the annual Part B deductible. You are ordinarily responsible for the remaining 20%. Plan G generally pays that remaining 20% for Medicare-approved Part B services. Here is a simple example. Assume you have already paid your Part B deductible and receive a Medicare-approved outpatient service costing $10,000. Original Medicare generally pays $8,000. Plan G generally pays the remaining $2,000. The one routine gap that Plan G leaves for you is the annual Part B deductible. In 2026, that deductible is $283. You pay it once for the year. After that, Plan G generally picks up the Medicare-approved cost-sharing included in the policy. Plan G also covers Part B excess charges. Those can occur when a provider does not accept Medicare assignment and is legally permitted to charge more than the Medicare-approved amount. The appeal of Plan G is predictability. You pay a higher monthly premium, but after paying the annual Part B deductible, you should encounter relatively few, if any, additional bills for Medicare-approved services. That does not mean all healthcare is free. You still pay your Medicare and Medigap premiums, prescription drug costs, and anything Medicare does not cover. Plan N provides substantial Medigap coverage too, but it generally asks you to share more of the cost. On the hospital side, Plan N provides the same standardized protection as Plan G for the Part A hospital deductible and covered hospital co-insurance. On the Part B side, Plan N generally covers the 20% left after Medicare pays its share, but with several important differences. First, Plan N does not pay the annual Part B deductible. You pay the same $283 deductible that you would pay with Plan G. Second, you may pay up to $20 for certain office visits. Third, you may pay up to $50 for an emergency room visit that does not result in inpatient admission. If the emergency room visit results in admission, that particular copayment does not apply. Fourth, Plan N does not cover Part B excess charges. If a provider does not accept Medicare assignment and is legally permitted to bill more than the Medicare-approved amount, be aware that the additional charges belongs to you and are your financial responsibility. That makes one question especially important for a Plan N member. Does this provider accept Medicare assignment? That is more precise than simply asking whether the provider accepts Medicare. The appeal of Plan N is the potential premium savings. You may pay less each month, but you accept more expenses as you use healthcare. The choice is not really about which plan provides good coverage. Both do. The choice is about how you prefer to pay. Plan G allows you to prepay more of your potential medical expenses through a higher monthly premium. In return, your expenses for Medicare-approved services are generally more predictable. Plan N may allow you to keep more money in your pocket each month, but in return, you accept possible office visit copayments, possible emergency room copayments, and the risk of Part B excess charges, which can be substantial. Suppose Plan N saves you $40 each month compared with Plan G. That is $480 in annual premium savings. Now ask yourself, how frequently do I visit doctors? Do my physicians accept Medicare assignment? How much could I pay in Plan N copayments? Is the possible $480 savings enough to justify the additional bills and uncertainty? That is the calculation, not simply which plan advertises the lower premium. Here is the entire comparison on one screen. Both plans cover the major standardized Part A hospital gaps. Both require you to pay the annual Part B deductible. Both generally cover the 20% Part B coinsurance remaining after Medicare pays its share. Plan G has no Plan N office or emergency room copayments. Plan N may charge up to $20 for certain office visits and up to $50 for an emergency room visit that does not result in admission. Plan G covers Part B excess charges. Plan N does not. Plan G generally offers greater predictability, whereas Plan N offers a lower monthly premium. You may hear people say, Plan F provides even more coverage. That is true, but if you are becoming eligible for Medicare in 2026, Plan F is generally not available to you. It remains relevant to certain people who were eligible for Medicare before January 1st, 2020. For a new 2026 beneficiary, however, the practical comparison is Plan G versus Plan N. Neither Plan G nor Plan N ordinarily includes outpatient prescription drug coverage. For that, you generally need a separate Part D plan. They also generally do not cover routine dental or vision care, hearing aids, or long-term custodial care. Both offer limited foreign travel emergency benefits, but that is not the same as comprehensive international medical coverage. And each Medigap policy covers one person. A married couple needs two policies and pays two premiums. Your federal Medigap open enrollment period generally lasts 6 months. Beginning the first month, you have Medicare Part B and are 65 or older. During that protected period, you can buy any Medigap policy sold to you in your state without being denied or charged more because of your health. That window generally occurs only once. It does not return every October. After it ends, unless you have a guaranteed issue right or additional state protection, an insurer may ask health questions, charge more, or decline your application. Do not assume you can spend several years in Medicare Advantage, return to Original Medicare, and automatically purchase Plan G or Plan N. Returning to Original Medicare and qualifying for a Medigap policy can be two separate questions. In most states, Medigap plans are standardized. Plan G from one company provides the same standardized medical benefits as Plan G from another. The same is true for Plan N. What changes is the premium, discounts, customer service, and history of rate increases. Compare the same letter across several companies. Do not choose solely by the lowest introductory price. Massachusetts, Minnesota, and Wisconsin use different Medigap standardization systems, so residents of those states need state-specific comparisons. Here is the decision in one sentence. Plan G charges more upfront for greater predictability. Plan N charges less upfront but asks you to pay more as you use care. If you visit doctors frequently, want protection from excess charges, or simply dislike receiving medical bills, Plan G may justify its higher premium. If Plan N produces meaningful premium savings, your providers accept Medicare assignment, and you are comfortable with occasional co-payments, Plan N may be the better value. Neither plan wins automatically. The smarter choice is the one that gives you the best total annual cost, not merely the lowest monthly premium. If this helped, please like the video, subscribe to Wealth Horizons, and share it with someone entering Medicare in 2026.